Hello and welcome to Indus Special. I'm Meshal Malik. According to the World Health Organization, some 450,000 people died in 2015 due to drug overdose. The increase in global cocaine production rose 25% from 2015 to 2016. The quantity of heroin seized globally reached a record high of 91 tons in 2016. According to the 2018 Global Drug Report, individuals aged from 12 to 17 years are in critical risk period for the initiation of substance use, and this may peak amongst young people aged 18 to 25 years. While numbers regarding substance abuse vary from region to region and are often underreported, the increase in the production trend of drugs indicates that the consumption of drugs has also increased. With the youth being the most vulnerable age group, we will discuss today why and how substance abuse has increased amongst young people. We will also discuss the types of drugs commonly taken and how they are adversely impacting the body. And since most of the youth are studying in universities and schools, we will talk to our esteemed guests regarding how these institutions need to tackle this issue and how society must help in the process of rehabilitation. We're joined today with Dr. Zulfikar Gilani, who's a psychologist. Thank you so much for joining us, doctor. So the UN World Drug Report states that not all young people are equally vulnerable to substance abuse. What makes some young people more vulnerable to substance abuse, doctor?
Well, there's a multiplicity of factors, but I think the most important one is sort of the sociological factor, I mean the environment in which they're born and they're raised. So family comes into the picture first. If there is a addict or a drug abuser in the family, then the likelihood of the child growing up in such an environment of then later on abusing drugs is greater. So besides that, then there are, of course, developmental issues, psychological development issues. I don't need to go into too much details, but certain types of personality, in a sense, increase the likelihood of the child in later years to move towards drugs. Probably the most important personality factor is what in psychoanalytic terms is referred to as delay of gratification, and in common language we talk about issues of impulsivity, in a sense. Some people, while they're growing up as children, for a variety of complex reasons, they never fully learn that if they desire something, that their need may not be met right away. So if they have a need and they want to somehow immediately
so it's about instant gratification.
It's about instant gratification. But that's not only in the family. Currently, I think the media and the advertising industry also is, on a macro level, contributing to that sort of a personality.
Doctor, I'd also like to, since you mentioned sociological factors, what about street children? Are they more vulnerable to drug abuse?
Yes, but depends on, I mean, the other major factor is sort of accessibility. But that will vary from place to place in a sense. Certain places have more accessible drugs. And now the street children are likely to be more likely to be abusing drugs, A, for accessibility, and B, I think the other major psychological factor is trauma. If there is traumatic experiences, which the street child is likely to have many of during his or her growing up, then again, I can't go into the psychological details of this, but when people experience trauma, especially when children experience trauma, and then the psychological pain is so severe that they
Dr. Gilani, we are also joined with Akshay Nanti, who is a former drug addict. We'd like to move on to him as well and bring him into this conversation. Thank you for joining us, Akshay. Since we're talking about trauma and how that could cause a person to move towards drug addiction, can you tell us from your own personal experience, what was the main reason why you moved towards drugs?
Sure. So I actually moved towards drugs when I was in high school. At that point, I hadn't experienced any trauma. I'd lived a good life. My parents had provided a lot for me. I got into drug addiction as a very well-off kid in a wealthy school in Austin, Texas. And then I struggled with alcohol addiction. This was after my time in the military, after going to war, and I lost friends in the war, and I was diagnosed with PTSD. So I struggled with alcoholism many years after the war in relation to the trauma experience, but drug addiction was before that, and I was just a well-off kid looking for a high.
So when you're saying you were just looking for a high, so Dr. Gilani also mentioned here that most kids do it for an instant gratification. Is that true? Was that the same case for you?
100%. I mean, at the core of it, whether it was drug addiction in high school or alcoholism after, what I've come to learn through a lot of life experience and research as well in neuroscience psychology is that we are looking for that instant feeling of that dopamine, that rush. And we have a negative relationship to the experience of struggle, to the experience of suffering. And what I've learned is when you develop a positive relationship to that, when you're able to smile in the face of struggle, you stop looking for that instant high. That's why today I've channeled that addictive personality into ultra running, into building a business. I love the struggle. I love the fight of that. But I fully agree with the doctor. It's absolutely looking for that instant feeling of just contentment because we're running away from whatever pain might be there in life, no matter how objective that pain might be in terms of how the outside world perceives it.
Can you tell us a little about the addiction formation years, step by step? How did it begin? Did it just begin with trying a little and growing into something more insidious?
Yeah, when I moved to Austin, Texas, I mean, part of it was this was my 5th city in about 13 years. So I moved around a lot, was very unsure of who I was not confident in myself at all, definitely not the person I am today, very lost. And I got into a group, and I don't blame my group of friends because I take responsibility for my action, but I got into a group of friends that we started smoking marijuana, drinking alcohol, and that then led to more intense drugs like cocaine, like LSD, and doing it at a very extreme level. I've just kind of realized that I've always been the person who would take it just to a different level. I mean, I have cuts on my arm for when I used to cut my arm, burn myself here, and always just taking it to a different level that I now, again, channel positively. But I was just very lost, and I wasn't sure who I was, so I found a group and used that as an outlet for myself, and if I found a group of ultra runners, I perhaps might have got into ultra running a lot earlier, but no regrets. The journey is what it is.
Akshay, to hear that you have such a positive outlook on it now. But Dr. Gilani, something that Akshay mentioned here was that he was with a group of friends when he started using drugs. And of course, he says that it is his responsibility. But can you tell us how much of peer pressure is involved for young people to get involved in drugs?
I wouldn't call it peer pressure, but belonging to a peer group where the use of drugs is the norm. That is usually the case. I mean, in probably most cases, people, whether they gravitate towards such a group or whether becoming part of such a group, causality I'm not very sure of, but peer group influences seem to play a very large part in this. The other thing which I want to mention here is that drug addiction or drug abuse is usually what people refer to as comorbid with psychological, quite considerable psychological problems like depression or anxiety and stuff like that. Now, there are some cases where, again, causality here is not very clear, whether the internal stress or the internal mental problems are pushing the person towards that it's sort of trying to numb the pain. So the drugs are used, could be used to numb that feeling of deep gloom and sadness which a depressed person may feel. So be that as it may, usually whether it's the psychological problem which is causing the drug addiction or whether it's the drug addiction causing the psychological problem, that's a separate question.
Dr.
But
Gilani,
usually these are comorbid.
So you mentioned how causality is something ambiguous at this point, but something that Akshay mentioned as well was dopamine and how it gives you a high of sorts. And then you're also talking about how drugs numb pain on the other hand. So which is it? Is it both? Do people react differently to the same type of drug? What's the science behind that?
Well, I mean, there are all kinds of drugs. So, I mean, the most harmful, I mean, there's all sorts of issues like alcohol is there, but alcohol has a different effect on the neuroreceptors and all. And then there are the opioids, which is a total different class of drugs, and which the origin is the opium or the poppy plant, and then morphine and heroin and so on and so forth. So I'm not too clued into the physiology or the genetics of this whole drug addiction process. I mean, I'm familiar with it, but I just wanted to bring into the picture the whole issue of other psychological problems which go hand in hand with drug addiction.
Dr. Gilani, on that same point, let's also bring Akshay back into this conversation. Akshay, so children, young adults can differentiate between soft drugs and hard drugs. Can you tell us about that? And most kids find it easier to gravitate towards soft drugs because they assume that the use of those will not be as damaging.
Yeah, you know, like when we started, alcohol again is readily available. Marijuana is a softer drug. Now it's legalized in much of the US. And then you start going to the harder stuff like cocaine, crack, heroin. I lost 2 friends to crack overdose and a heroin overdose and was very much headed down that path. So, you know, some people sometimes would say that marijuana is a gateway drug, which I don't know if I'm fully convinced myself. It's just kind of where you go. I have friends to this day who might be smoking on the weekend and they're very sort of productive members of society that haven't gravitated to hard drugs. I was at a point in my life that I would have done any drug that came my way, and thankfully more did not.
So there was never, Akshay, never in a point of time, there was a distinction between, okay, these are the drugs I don't want to touch in any situation because they will have a higher rate of addiction, and these are drugs that are okay, fine. You're saying that you were willing to take anything.
Just at the point that I was, because to me at that point, drugs was my expression of pushing myself, of testing my limits. As I said, now I channel it in more positive ways, but that was my expression. And I mean, I remember I was looking for at one point Special K. I was willing to try PCP, which is very, very intense. And thankfully, again, some of this stuff didn't come my way. And I got out of that world before some of the harder drugs started coming into that environment. But yeah, that's who I was at that moment. And of course, it could have turned out very badly. And it did for 2 of my friends.
Akshay, so you're saying that you wanted to test yourself. Was that physically or mentally? What were some of the issues that you were grappling with at that point in time?
You know, I think it was again, I hadn't experienced trauma at this point. A great childhood, loving parents, all of that. I think I was just lost, and this was my way to express myself. I was the one in the group doing the craziest things, so that's how I stood out. You know, it was my way to stand out, I guess. Like I said, I used to cut myself and I would play with knives, throw knives in the air, and just do these very crazy things that had me stand out. And it was my way to see how far could I go. I mean, I remember at one point taking 18 hits of LSD.
Why did you want to stand out so much? Was it?
I realize now that I think all human beings have a need for significance, and this was a very unhealthy way to express it. You know, I talk about ego a lot too in my work, and ego is not something that should be demonized. Ego can be really useful. This is why pro athletes talk a lot about how they know how great they are. But at that point, my ego, I didn't have the self-awareness I do now. So I was looking for that expression because, again, I was very unconfident, moved to 5 different cities, lost about who I wanted to be in the world. So I wanted to somehow stand out. I remember being this goofy, skinny kid moving to the US and just, like finding a way to say I'm the cool one in the group, right? And this was an expression for me to do that. And to this day, I still have a need for significance. I'm just able to be aware of it and express it in a healthy way.
Actually, that's a very important point you mentioned, and I think Dr. Gilani would be helpful in shedding some light on social development years and why kids in this age are more vulnerable. Is it because their personalities are rapidly developing?
Both things are true. I mean, I subscribe to the sort of what I consider a truism that the early years are extremely important for personality development. And now, for a variety of reasons, I don't want to go into that again, but sometimes children are struggling with identity. Their identity issues are all over the place. And although Akshay really talked about sort of being significant, but perhaps another factor there is so there's this one issue of identity, and there's a whole process of identity development. Great work has been done on that.
Dr. Gilani, when we're talking about identity at this point, a lot of conversation comes up about how social exclusion leads to often people moving towards harmful substances, self-damaging ways. Is that one of the causes?
Yes, I mean, you put an extremely important, where the child doesn't feel included in a sense. But it really connects up to the other point which I was just going to come to, which is this whole issue of acceptance, being accepted by the others, being sort of good enough. Now, again, complicated set of variables which determine when a child feels included, child feels sort of secure about his or her own self, in a sense, what Akshay was referring to as ego. So now, if there are problems, I mean, in the development of that, how should I say, the sense of security, sense of inclusiveness, a sort of a clarity about who I am. If there are problems in those areas, it doesn't necessarily mean that the person will go to drugs, but the likelihood to reaching out to some other ways to sort of define oneself and to get included. This one of the thing of peer group thing is that's many times the only group which accepts this child. Okay, that you come and join us, and then to sort of further ensure one's inclusiveness in that group.
Thank you so much, Dr. Zulfikar Gilani, joining us. Akshay, let's move on to you again. So we were talking about social exclusion, and you talked about how you always wanted to stand out amongst your group of friends. Was there any point in time that you felt like you were shunned because you were moving towards drug addiction?
Not in that group at all. In the group that I was in, I mean, most of us, if not all of us, were doing it anyway, right? So it just was a natural fit in that particular group that I was in.
But that's that particular group. What about the larger society? It
didn't matter because I found my world. I mean, I got caught smoking marijuana in school. I lied to my parents at the time. Now, obviously, they know everything about it, but I lied to my parents about what I did, and so I got in a lot of trouble. But outside of that world, that was the world I was in. It didn't really matter what the external world might have thought about me. And my parents, many times when you're growing up, parents are the enemy kind of thing. So even though they were provided for me, again, I've been a nightmare of a child to them, but it didn't matter necessarily. They thought that I stopped doing drugs when I got caught, but it wasn't. That's not why I stopped. When I found a trigger that this was my new path in life, that's what finally had me stop. But it makes it for today's day and age, I feel like the kids are coming up in a very complicated world. We got these little dopamine machines right here, right? Like our phones. And we live in a world that feeds this instant gratification all the time. So it makes it so much more complicated that today's kids are feeding into this idea of looking for the easiest way out, getting those little dopamine rushes, that the progression to drugs is a lot more natural and dangerous
Actually,
ultimately.
on that point, so you're mentioning how dopamine surrounds us and we move to it in any way possible. But still, when we're talking about drugs, how easy was it to access them?
It's incredibly easy in my school. We were in one of the best schools in Austin, Texas, and one of the top schools in the country in the United States at the time. Incredibly easy. It was easier to get drugs than it was to get alcohol at the time. So I guess if you know where you're looking for, I mean, eventually, because alcohol, they had a firm ID policy in the US, you had to be 21. So getting drugs from our dealer was not hard. I had a part-time job and that's where my money was going. It was really, really easy to access it. And now that I hear, even in India, I'm currently in India, I hear that it's all over. I hear it's very prevalent. I obviously don't know that world anymore.
Especially in Punjab.
Especially. Yep.
So I just want to talk a little more about how kids are influenced by media when it comes to drugs. So in 2014, an article came out in the UK that because of that Netflix series Breaking Bad, meth buying shot up. So how much does media influence and glamorize the world of drugs?
I think that ultimately we are all at the effect of our environment to a huge degree. And when you're a kid, you're not coming into the world with a high degree of self-awareness. So you're responding and it's shaping how you respond, how you react to the world, who you are. And so it definitely, everything that is being soaked in, and again, neuroscience has shown there's a thing called the Jennifer Aniston neuron where people who watch Friends, like their brain would fire when they would see pictures of Jennifer Aniston. And they did this with many different celebrities. And depending on what show you watch, it would trigger your brain in certain ways. So we are constantly at the effect of our environment. Even if you're exercising a high degree of self-awareness, it's still really hard. So for kids, it's a huge factor. And as I said, I mean, you're following social media. We think what we want in life is a certain way of being, is this easy life. But the easy life is not the good life. And easiness, like easier is not better. And we live in a world that's feeding that's who we should be, what we should be looking for. So when you're a kid responding to the world for that, you're inevitably going to look for the easy way out when things get a little bit hard. And they do. Life is going to throw like punches in our face from time to time, right? And even if whether you're seeking a hard goal or not, life is going to get hard. And if you're constantly taught to run away from that, to look for easy, drugs is a natural evolution.
Akshay, one last question. So in retrospect, do you believe that you made the right decision to stop then and there when you did?
100%. I mean, I ended up, joining the military, and now who I am today, writing books that were endorsed by the Dalai Lama, running ultra marathons. I don't regret, but I know that I could have died. Like I said, I lost friends to that. But I could not be happier that I got out of both drugs and then alcoholism as well. Now I'm 100% sober and living a fantastic life and really blessed to be here.
Akshay, congratulations on your journey, and we are very glad that you shared it with us. Thank you. We're going to take a little short break. When we return, we're going to talk about the harmful effects of drugs on the human body. Stay with us. Welcome back to Indus Special. Now we're going to move on and talk about how drugs harm the body. We're joined with Dr. Salman Kazmi, who is from Mayo Hospital, and Dr. Sunil Sharma, Director of Karabam's Group from India. Thank you so much for joining us both. Dr. Kazmi, let's move on. Let's first start with you. So can you take us through the process of how the organs are damaged once a person starts consuming drugs?
Madam, it depends on the type of the drug which the person is using. For example, you might find IV drug abusers there on the roads in Lahore, like in Lakshmi Chowk area or in Chaburji, and they are injecting a white crystal mixed with water or a distilled water into their veins, and that ultimately leads to a breach in the epidermis, and that leads to entry of the bacteria into the blood supply, which ultimately move into the heart and damage the heart valves. Even from the heart valves, an embolus might break and it might go into the brain. We might have a brain abscess there. And for example, and these people who are IV drug abusers, they share needles with each other. For example, one of them might be injecting one person and then another person with the same needle. And that would actually lead to transmission of HIV, hepatitis B, C, and that they might end up with frank AIDS leading to a PCP pneumonia or a stroke or something like that, and they might even even might end up with rheumatic heart disease. Their heart valves get damaged, and ultimately they have to go to the hospitals. They need hospital admissions, and and some of them might even die on the roads because they don't even get medical treatment. Some of them develop cellulitis on the legs. This is one type of drug abuse that is happening, and this is one of the type which would kill the individual very fast. They would probably die in 6 months or 1 year, or maybe for 1.5 years, because they cannot use sterile syringes. They get contaminated. This all can get contaminated. Now there are females joining them as well on the roads. If you go and travel on the in various parts of Lahore, you would find them on the roads, and there are females as well with them who are injecting drugs.
Also, when we're talking about people on the streets, of course, issues of sterilization occur.
You know, there are students as well who are doing that in medical colleges or in other universities and
what about
educational institutions. They are doing IV drug abuse, and they are unfortunately buying these drugs from the medical stores which are around these places. Like they are quite easily accessible because they would go to the store, and they are fixed stores in the Lahore city, and you can go to them and buy drugs. And after 10 p.m. at night, most of the girls and the students go there and they buy them, and you can easily locate them. One of them was in front of the Gangaram hospital and in Lahore, and it has recently been sealed by the district government. One of them is in front of Mayo Hospital, and it is constantly selling drugs.
I would also like to ask Dr. Sharma on the point of accessibility. How easy is it to access drugs?
Pretty easy to get into these substances. I think, listening to the doctor there, it's as prevalent as there is here as well in India. And most of them are unfortunately youngsters in their formative ages. They are the ones who get into all these substances. Most frequently used substances back in here and world over is, of course, the cannabis, which they use it as different forms of either it could be hashish or it could be smoking.
Dr. Sharma, I hate to interrupt here, but since you mentioned cannabis, I just want to ask you, a lot of students perceive cannabis as being not very harmful, and even ecstasy. Can you tell us if these drugs are in fact safe?
Okay, see, the statistics says that, the recent 2018 United Nations Office on Drug and Crime, they report that nearly 180 million people, they have used cannabis in the last year, that is 2016-17, about 180 million people have used it. So the medical data says that of the people who use marijuana, cannabis or different forms of cannabis, it is known that nearly 15 to 17%, less than 20% of them have a tendency to develop what we call dependency. When they develop dependency, that becomes a medical problem. Like people who take alcohol, like people who smoke tobacco or cigarettes, it's some proportion of them who develop problems. So since the 70% plus people can smoke once in a while on a recreational mode and they can live a near normal life, people do have a tendency to think that cannabis is not harmful. But unfortunately, the age group in which people get into cannabis is very, very young. That is adolescent, starting from 8th, 9th standard, 8th, 9th grade. That is, say, about 12, 10, 11, 12 years onwards is when they start using cannabis. That is when actually the brain is developing. Some part of the brain is actually developing at that particular stage. And when they start taking cannabis, it has adverse impact on the development of the brain, leading to different kinds of problems. Their IQ might come down over a period of time for long term, those people who use it on a long term, and some people might develop what we call an amotivational syndrome. Their motivation level to do things will be much, much lesser compared to others. So there is always, of course, with respect to cannabis, there is always a debate. Some people do talk about it being good. Some people do talk about, there are scientific evidence to say that it is harmful, and there is also scientific evidence to say that in some proportion of people, it might not have any kind of an adverse effect. So it's a controversial drug, but it is one of the certainly
Dr. Sharma, stay
the
with us. Let's bring Dr. Kazmi back into the conversation. Dr. Kazmi, how can prescribed drugs be misused, prescription drugs?
Madam, unfortunately in Pakistan, they don't even, they just go to the store and ask for the drug and it is given. We've been repeatedly requesting the government to develop a software in which the PMDC number of the doctor, we the doctors which are working in the various hospitals, and we daily receive such patients in the emergencies. We've been daily requesting the government that they need to develop a software in which the PMDC number of the doctor gets added, so that it is in the record that which doctor had prescribed that and which pharmacist has dispensed the drug. And unfortunately, although there is a software at all the medical stores and they keep their local records, but there is no central linkage of all that. We need to develop it is quite easy to check that who is prescribing and how they are being sold. Unfortunately, at the moment they just go to the store and they say that give us.
Prescription drugs exactly misused?
They are actually sold without any prescription. You just go there and you say that I need 20 injections of Avel, and they will give you the 20 injections.
So at
and
the
you can go and mix them.
They use more than what is prescribed.
Yes, they just give you 10 injections, and you can actually inject all the 10 together, and the individual who's using it would feel a sense of satisfaction, and he would be pleased and he would sleep, and he would think that daily I need to give this injection or these 5 tablets and then I'll be able to sleep, and it becomes the normal drug which was actually used for a disease becomes an addiction. And that is how these students in various one addiction is the smoking and these drugs which are filled in the cigarette and they are smoked. The other is the normal drugs which are used for sleeping or for allergies and Avel, and they are actually misused and they are used for recreation.
So how do these prescription drugs, damage the organs step by step? What is their damaging procedure?
Like it depends on the drug which is being used. Like if a benzodiazepine is it is taken in overdose, it might lead to respiratory failure. And then like an opioid is used, and it can have.
You're mentioning very technical names here, but which drugs are these exactly? Are they antidepressants? Are they?
You can actually say that they are like antidepressants or antipsychotics, and they can be misused and they can be used. But unfortunately, most of these kids who are using these drugs are having some psychiatric ailment. They need to be assessed for that, and we need to know that either they are having schizophrenia, depression, bipolar disorder, and we need to treat that. Like every school or university or medical college, when they are admitting students, they need to have a psychiatric evaluation board of these students, and they need to see that if someone of them is having a psychiatric ailment, they should be prescribed a drug or two instead of they should later be trying to take IV drugs or other drugs to relieve their symptoms.
Dr. Sharma, these sleeping pills, are they meant to induce sleep?
When they take it, they get a different kind of a high. That's one. And there are certain stimulants. For example, we use certain medications in people who have memory issues, say beyond 80 years of age. Some people, they develop what we call dementia, memory problem related issues, age related issues. For them, we use certain forms of medications which enhances their memory or at least helps them retain some amount of short-term memory. So these drugs are freely available, and students, what we have seen is before exams, say about 3-4 months before exams, they start taking these kind of stimulant tablets along with antidepressants, which reduces their need for sleep, and it makes them very alert and active. There is of course a chance of them getting into psychiatric condition, as doctor was saying, what we call a manic phase or a hypomanic phase that they can get into. But this is also one more most prevalent way that unfortunately many students do abuse. And
Dr. Sharma, but these drugs that you're referring to, they're commonly known as study drugs, smart drugs. They're available over the counter, very easily available, and the purpose is to heighten concentration. Am I correct?
True, you're right.
So isn't the system almost allowing students, enabling them to use these drugs because of the higher pressure environment they are placed in?
Absolutely. As the other doctor was also saying, I feel there needs to be a stringent, regulation of pharmaceuticals. I mean, the people who dispense medication, unless there is a prescription, and I think there the Medical Council of the Pakistan will have a number which is given to the medical practitioner. Similarly, here the Medical Council of India gives them the number. Unless that particular number is registered and that particular number is noted down, the pharmacist should not be giving the medication. But unfortunately, that is not the scenario, and we are not so stringent in enforcing the law.
And Dr. Sharma, what are the side effects of using these study drugs, these smart drugs?
See, it's basically a stimulant. So if somebody is under stimulation for a longer period of time, his need for sleep comes down, and though in the shorter duration of few weeks before the exams, it might help him to improve his concentration and also the memory, but it will damage his system, and they might develop, once they stop taking it, they will have what we call withdrawal, that is of stopping the medication. They feel very irritable, angry, and their sleep gets disturbed, and they can eventually get into a depressive state, which could be a transient one, which can be recovered with medication. Some of them might get into a permanent depressive stage, and that might be a lifelong psychiatric problem that they might develop.
Dr. Kazmi, so we're talking about smart drugs and study drugs, and a lot of students complain that they might have ADHD. So can you tell us about this concentration disorder, so students are more aware that it might not be this problem for which they need this drug?
Actually, most of the students don't know anything about psychiatry. They have never been exposed to this. They don't know how the symptoms are. Most of them are in depression. Some of them don't study during the exams. They're very much worried. They might start getting up very early. They might start crying. They might be very much worried. They might be tense. And then, they might have ideas about doing a suicide or, ending up their life, which is actually in depression. And similarly, some of them might be having illusions and delusions, like hearing voices, like seeing things, or something like if they're sitting in a room and they might hear someone talking.
These would be psychological disorders.
These are all symptoms of psychological disorders. And
what about ADHD specifically?
This is for this, they might be having symptoms like they cannot concentrate on reading a particular thing. Their thought process might deviate. They would be trying to concentrate, but they're not able to retain. And for that,
they sound like very common problems. What is that one distinct, or those couple of distinct factors that makes a student understand that yes, I have a psychological problem?
There are no particular as such. There's no particular set. But if they are waking up early in the morning, they're thinking about, they're too much worried, they're crying, they're too much anxious, tense. And they're too much involved in other ways to vent out, like they're trying to ask people, and they're trying to put their attention on one thing by taking some drug. They might decide to consult their psychiatry department or a psychiatrist in their area, who might actually help them by giving them a drug, and that would put them back into normal life. Although it would be taken for 3 months or 6 months.
Those are safe drugs that are
they are safe drugs, and they would be under a check. They would be taking that, and he would particularly be monitoring them. That would be far better, instead of doing all this and going out for drugs and finding other ways and means to lessen or to increase their sleep and to put their self back into the system.
Dr. Sharma, we are talking about how students suffering from psychological disorders might be able to identify those. But what about students who are abusing drugs? What are the ways in which society at large, their universities, can identify that this person is suffering from drug abuse?
See, first and foremost thing is, one, their attendance drop. Okay, a student who was very punctual, regular, and attending the classes, when he gets into these substances, first thing that will be very, very evident is he's not interested in his studies and he's not interested in attending the classes. So attendance would be one of the important things when we when we see different patients here, and when we talk to the families also, they say that, the first semester or second semester of their degree, the teachers or the college did give them an intimation that, your son has less attendance, and they ignored it. They said, okay, maybe he's recently joined the college and, he's going out with his friends. So, but that's first thing that will be there. And second, changes in his friend circle. Okay. So that is, generally I will have friends of my type. When they get into substances, they would like to change the friend circle and they would like to move on with people who are substance abusers or substance dependent people. Generally, who are very regular to the school or colleges and studying, they might not be the people who are abusers. They might be users, but they might not be abusers and dependent users. So they change the friend circle and they move on with a different kind of friends. And wanting to stay alone, away from the friends or their normal community, they like to stay alone because they would like to use this particular substances, fall in the grades, in their grades, which it could be whatever the grades that they were getting it earlier, they would be falling their grades, which can be an indication that either this person is developing some kind of a psychological issue or some kind of a mental health issue, or he might be getting into substances.
Dr. Sharma, but you're talking about falling grades here and students dropping out, but we do know that in elite institutions as well, there is a lot of drug abuse amongst students who have a very high IQ. So how do we identify them abusing drugs?
This is the broader general ways of looking at it or kind of indicating if this person has or gotten into substances. Other way would be specific to the substance that they are into. For example, if somebody is on cocaine, heroin or methamphetamine, they're all highly stimulant in nature and the person can have behavioral problems, maybe getting very aggressive and very impulsive, or psychotic symptoms the doctor was talking about, that hearing voices or talking to oneself, and lack of self-care, not taking care of himself, not taking bath, it could be for days, and also staying in one place for a longer period of time because he does not have any intention or any motivation to do anything apart from the substances. So when we get into individual level, it will be probably drug specific and individual specific, which becomes much more medical in nature. So from a community point of view, it's the broader sense that, whether this boy, whoever he was, is there a sudden change in his nature, his personality, his behavior, his communication, his friend circle? If there is a change, there is certainly need of investigating it further, and we need to be a little suspicious about.
So, Dr. Sharma, what you're saying is that drastic changes in behavior are the best way to identify that someone is abusing drugs. Can you tell us and the viewers about how there might be a different reaction towards drugs for different people?
The reaction to the drugs depends upon their physical ability to metabolize it or the tolerance level that individuals has. Some people have higher tolerance. I think this is a common experience that somebody is able to take one or two drinks and he is still perfectly fine moving around and not having any issues, but some people with just one or two drinks can be highly intoxicated and with a lot of disinhibitive behaviors. So it depends upon the individual's body's ability to metabolize that particular substance.
Sharma, how important is it for caregivers, for parents to be involved and for them to identify when their child or a student, even teachers, are behaving differently?
See, the role of different people is very critical when an adolescent is into the substance. One, the students or his peer group, the friends, they play a very, very important role in identifying, and their communication and what they say, how they talk and how they treat him becomes very important. So we have to look at it from a community level at the school level itself. Second, the teachers and the school environment plays a very important role. And of course, the important people, of course, are the parents, who are responsible for overall care, treatment, and then post-treatment, the recovery part of it, and supporting the child. And then at a social level, availability of these substances and how do we prevent, unless we address all the areas. I don't think there is a
Thank you so much, Dr. Sunil Sharma, for joining us. It was very insightful talking to you. Dr. Kazmi, let's move on to you. So you were talking about how schools, universities need to play a more proactive role. Can you tell us about that?
I would actually point that out that this is very much required, that we need to launch a new idea in the government sector, that whichever student gets admitted into the school or college or into a medical college, he should have a psychiatric board for evaluation of his mental state examination, and he should have that regularly for 5 years or 4 years, once a year, so that if he is having some depression, bipolar, schizophrenia, anything, he is actually pointed out, that gets pointed out, and he is treated for that, so that it doesn't end up into a suicide. We have seen so many cases of suicides in the recent last 2-3 months, and so many cases have been reported in even medical colleges. So we need to point that out, and we need to screen these people pre-hand, so that they don't end up into the ending up their life.
So Dr. Kazmi, there's a paradox here, because a lot of people don't come forth with their mental health conditions precisely because they don't
Nobody would come forward. We have to do it as a compulsory measure.
But wouldn't that cause for them to have their school life disrupted?
No, it won't be for one particular person. It would be for everyone. Every student will be having it, so nobody would mind that.
But say if a student is identified with a psychological issue.
But they won't tell it. The doctor won't tell anyone. We've been doing medicals in the medical colleges for the medicine, surgical issues, and so many other things.
Even if patient-doctor confidentiality is observed in this matter, what I'm trying to ask is that once they are identified with having an issue, will their treatment go alongside their education, or will it?
Yeah, it would perfectly go on, because a number of students are already being treated in our hospital, and they come there with depression, and they're regular in follow-up, because they're regular there, and they know that they have to come and see us after 15 days or 30 days, once a month. It is not difficult for them, and they also realize and understand, and then they feel happy about it, because they feel that they are better. And it is must, and this concept should also be introduced at the level of the family courts, where husband wives are fighting and they are over kids, and that should also be addressed, because most of the judges in the civil judges try to resolve the issue instead of getting their medical examinations done. 90% of them are having various psychiatric ailments, and they need treatment. Instead of resolving the dispute between the husband-wife, they should both be sent to the medical board, and they should be treated for if they are having some psychiatric issues, so that they don't kill each other later on.
Dr. Kazmi, let's go back to institutions here. So what do you think, in your opinion, would preventive measures be more successful, or punitive measures, giving punishment to those students who are found involved in drugs?
I would also like to mention here that first of all, we should go on with the screening program. We should introduce the screening program,
the screening has been done.
and we should treat them. And secondly, the sale should be ensured that the medical stores are linked to an IT system, so that they are not allowed to sell drugs to anyone unless the name of the doctor, the PMDC or license number of the doctor, and the license number of the pharmacist gets entered into the system, and then only the drug should be sold. So that it is not difficult, it is very easy. We have a full IT board here in Punjab, and we can easily link all the stores. It is very easily possible without spending a single money, without spending extra money. We can just link the computers, and it would be an internet based software, so we can even run it on our phone or any computer at any medical store.
Thank you so much, Dr. Salman Kazmi, for joining us. What Dr. Kazmi was talking about was integrating technology and being able to better tackle the issue of drug abuse. Of course, it's also important to move towards rehabilitation of those suffering from drug abuse and not isolating them further. Hope you liked today's show, and we'll see you again next week. Thank you.